The first victim crashed through the ER doors at 10:47 p.m. Dr. James Rivera looked up from the paperwork. He was finishing a routine Friday night shift, nothing unusual, and saw something that would redefine the word unusual for the rest of his life. The man was holding his neck. Blood pulsed between his fingers in rhythmic spurts. Arterial. Fatal in minutes without intervention. Gunshot wound. The paramedic yelled, already moving. Concert venue. Mass shooting. We've got. He didn't finish the sentence. Because behind him, 6 more ambulances were screaming into the bay. Then 12. Then 20. Dr. Rivera stood frozen for exactly 3 seconds. 3 seconds he'd replay in his mind 10,000 times afterward before his brain caught up to what his eyes were seeing. This wasn't a trauma case. This was a war zone. And he had 11 minutes to decide who would live and who would die. The night everything changed. October 13th, 2017. The Harvest Music Festival in Las Vegas should have been a celebration. 30,000 people gathered under open sky, listening to country music, drinking beer, holding hands with people they loved. A perfect autumn night. At 10:05 p.m., the shooting started. From the 32nd floor of the Mandalay Bay Hotel, a gunman opened fire into the crowd. Automatic weapons. 1,500 rounds in 11 minutes. People fell like dominoes, some dead before they hit the ground, others screaming, crawling, bleeding out on concrete still warm from the desert sun. By 10:16 p.m., the shooting had stopped. By 10:20 p.m., every hospital in Las Vegas was receiving calls to prepare for mass casualties. By 10:35 p.m., the first victims were arriving at Sunrise Hospital. Dr. James Rivera was the senior trauma surgeon on duty that night. 43 years old. 20 years of experience. He'd seen car crashes, stabbings, industrial accidents, everything the ER could throw at a person. He'd never seen this. At 10:47 p.m., the first patient arrived, the man with the neck wound. Rivera's team moved immediately, applying pressure, assessing damage, preparing for surgery. At 10:48 p.m., 3 more gurneys came through the doors. At 10:49 p.m., 7 more. By 10:51 p.m., the ER was full. By 10:55 p.m., patients were lined up in the hallways, the parking lot, the waiting room. Blood everywhere. Screaming. Chaos. Every available doctor, nurse, and medical student scrambling to triage, to stabilize, to make impossible decisions about who needed surgery first. Dr. Rivera stood in the center of it all and did the math. 47 critical patients requiring immediate surgical intervention. For operating rooms. 11 minutes before the first ones would die. He pulled out his phone and sent a hospital-wide emergency alert. All surgeons report to Sunrise immediately. All ORs active. All elective surgeries cancelled. This is not a drill. Then he made the first decision. The man with the neck wound, the first through the doors, would not be first to surgery. Someone else needed it more. The impossible math of triage. Triage is the ugliest word in medicine. It sounds clinical, professional. But what it really means is this: deciding who gets to live when you can't save everyone. In normal trauma situations, triage follows clear protocols. Red tags for critical immediate intervention required. Yellow tags for serious can wait an hour. Green tags for minor can wait indefinitely. Black tags for expectant, too far gone to save. But this wasn't normal trauma. This was 47 people who all deserved red tags. 47 people whose lives depended on getting into an or in the next 20 minutes. And only 4 operating rooms. Dr. Rivera moved through the ER like a machine, assessing each patient in 30 seconds or less. Gunshot wound to the abdomen, bleeding internally, red tag, or priority. Gunshot wound to the leg, femoral artery intact, yellow tag, can wait. Gunshot wound to the chest, tension pneumothorax, red tag, but can be stabilized with chest tube, surgery later. Gunshot wound to the head. He hesitated. The woman was maybe 25. blonde hair matted with blood. A bullet had entered her temple, exited behind her ear. She was still breathing somehow. Still alive. But her pupils were fixed and dilated. Brain death. Even if he operated, even if he stopped the bleeding, saved her life in the technical sense, she'd never wake up. Never speak. Never be the person she was 3 hours ago when she'd bought a concert ticket and thought the biggest risk of the night was a warm beer. Dr. Rivera placed a black tag on her wrist. Expectant. She would die. He moved to the next patient. The ones he chose. By 11:03 p.m., Rivera had tagged all 47 critical patients. 23 red tags. Immediate surgery required. 12 yellow tags. Serious but stable. 8 green tags. Walking wounded. For black tags. 4 people he was abandoning to death. The red tags were wheeled toward the ORs. But even 23 was impossible. Each surgery would take hours. Each patient needed a full surgical team, anesthesiologists, nurses, blood transfusions, post-op care. They had 4 operating rooms and maybe 8 surgeons in the entire hospital at this hour. Do the math. Rivera made the second impossible decision of the night. Anyone who can survive with damage control surgery gets it, he announced to his team. Stop the bleeding, close them up, move to the next. We're not doing perfect surgeries tonight. We're doing fast ones. Damage control surgery is battlefield medicine. You don't repair everything. You don't reconstruct. You pack wounds with gauze, clamp off bleeding vessels, close the patient up, and pray they survive long enough for definitive surgery later. It's brutal. It's imperfect. It saves lives when nothing else will. The first patient into OR1 was a 19-year-old kid with a bullet through his liver. Normally, a liver repair takes 4 to 6 hours of careful, precise surgery. Rivera did it in 47 minutes. He cut open the abdomen, found the bleeding vessel, clamped it, packed the wound cavity with surgical sponges, and closed. The kid's liver looked like a crime scene inside, but it wasn't bleeding anymore. Next patient. A woman in her 30s, gunshot to the abdomen, multiple bowel perforations. Normally, you'd repair each perforation carefully, check for contamination, irrigate thoroughly. Rivera cut out the damaged sections of bowel, stapled the ends, threw in antibiotics, closed her up. 32 minutes. Next patient. A man with a shattered femur and torn femoral artery. Normally, orthopedic reconstruction, vascular repair, hours of meticulous work. Rivera bypassed the artery with a temporary shunt, stabilized the fracture with external fixation. 28 minutes. Next patient. He worked like this for 6 hours straight. No breaks. No food. No water. Just surgery after surgery after surgery, each one a compromise between perfect and possible, each one a gamble that the patient would survive long enough for the real repairs later. His hands moved on autopilot. Cut. Clamp. Suture. Close. The motions burned into muscle memory by 20 years of training. But his mind was somewhere else. On the 4 black tags. On the woman with the head wound who was probably dead by now. On the decisions he'd made in 30-second intervals that determined who lived and who died. The ones he couldn't save. At 11:47 p.m., one of the black tags died. A 52-year-old man? Gunshot wound to the chest, bullet through the heart. He'd been conscious when the paramedics brought him in, talking, saying his wife's name. But the heart damage was catastrophic. Inoperable even in perfect conditions, let alone tonight. Rivera had looked at him for 15 seconds and made the call. Black tag. The man died holding a nurse's hand, asking for his wife. At 12:23 a.m., the second black tag died. A teenage girl. 17 years old. Multiple gunshot wounds to the abdomen and chest. She'd lost so much blood that even with transfusions, her body was shutting down. Massive coagulopathy, her blood wouldn't clot anymore. If Rivera operated, she'd bleed out on the table in minutes. Black tag. She died while a resident tried desperately to explain to her parents why their daughter wasn't in surgery. At 1:15 a.m., the third black tag died. An elderly man, 78, with a bullet through his aorta. The great vessel of the body, torn open. He'd somehow survived the ambulance ride, but his blood pressure was barely measurable. Emergency aortic surgery requires a specialized team, specific equipment, perfect conditions. They had none of that. Black tag. He died quietly, sedated, unconscious. The fourth black tag, the woman with the head wound, was still alive at 2 a.m. Still breathing. Still technically alive. But her brain was gone. Rivera checked on her twice during the night. Each time, he felt the weight of that black tag like a stone in his chest. Each time, he wondered if he'd made the right call. Each time, he moved on to the next patient who could be saved. The surgeon who couldn't stop. Imagine being in that operating room. The smell of blood so thick you can taste it. The sound of monitors beeping, alarms going off, voices calling for blood, for instruments, for help. Your hands covered in someone else's life, moving through tissue and vessels and organs that are supposed to stay inside bodies. Knowing that in the hallway, 20 more people are waiting. Knowing that every minute you spend on this patient is a minute someone else doesn't have. Would you work faster? Cut corners? Make choices you'd never make under normal circumstances? Would you become someone you don't recognize? Dr. Rivera operated on 14 people that night. 14 human beings whose lives depended entirely on decisions he made in fractions of seconds. 14 sets of families waiting in a lobby filled with grief and terror and desperate hope. He saved 13 of them. The 14th, a young man with a gunshot wound to the spine, survived the surgery but was paralyzed from the waist down. Rivera had made a choice during the operation: stabilize the spine quickly and move to the next critical patient, or take the time to attempt nerve preservation. He chose quickly. The man would never walk again. Rivera made that decision in 11 seconds. At 4:37 a.m., he finished his last surgery. Stepped out of the OR. Pulled off his mask and gloves. His scrubs were soaked through with blood, not from one patient, but from all of them. Layers of other people's trauma absorbed into fabric. A nurse told him the count: 47 critical patients admitted. 31 required surgery. 4 died before reaching the OR. Of the 27 who made it to surgery, 24 survived. 3 died on the table despite everything, including the woman with the head wound, who'd finally stopped breathing at 3:22 a.m. Dr. James Rivera had saved 24 lives in one night, and lost 7. He walked to the bathroom, locked the door, turned on the shower fully clothed and stood under the water until it ran clear. Then he sat on the floor and wept. The questions that never stop. In the days after the shooting, the hospital was flooded with media. Reporters wanted the hero's story, the dramatic saves, the miracle surgeon who'd worked through the night and brought people back from the edge of death. Dr. Rivera refused every interview, because he wasn't thinking about the 24 he'd saved. He was thinking about the 7 he'd lost. The man who died asking for his wife. The 17-year-old girl whose parents screamed at the resident. The woman with the head wound who he'd tagged for death in 15 seconds. Had he been right? Could she have survived if he tried? Would she have woken up, recovered, had a life? Or would she have remained in a vegetative state, and the time spent trying to save her would have cost someone else their life? He'd never know. That's the thing about triage decisions. You make them in moments of chaos with incomplete information and no time to deliberate. And then you live with them forever. 3 weeks after the shooting, Dr. Rivera returned to work. His first shift back was a Friday night. Quiet. Routine. A broken arm, a case of appendicitis, a kid who'd swallowed a penny. He stood in the ER and felt like an imposter. Like he was play-acting at being a doctor when real doctors didn't let 17-year-old girls die in hallways. At 11 p.m., a trauma call came in. Car accident, critical injuries, ETA 5 minutes. Rivera's hands started shaking. The patient arrived, a woman in her 50s, multiple injuries but stable. Routine trauma surgery. Rivera had done 1,000 of them. He froze. Couldn't move. Couldn't think. Couldn't decide where to start because every decision felt like life or death. Like choosing who lives and who dies. Like placing black tags on people who deserved better. Another surgeon stepped in. Took over. Saved the patient. Rivera walked out of the hospital and didn't come back for 3 months. The therapy no one talks about. PTSD isn't just for soldiers. Dr. Rivera learned that the hard way. In the months after the shooting, he experienced flashbacks, nightmares, panic attacks. He couldn't sleep without seeing the ER filled with bodies. Couldn't hear loud noises without flinching. Couldn't make simple decisions without spiraling into anxiety about making the wrong choice. He started therapy. For months he resisted. Doctors don't need therapy. Doctors are supposed to be strong, objective, professional. Doctors save lives, they don't fall apart afterward. But his therapist, a woman who specialized in trauma, told him something that changed everything. You're not supposed to be okay after what you experienced. You made decisions no human should have to make. You held people's lives in your hands and some of them died despite your best efforts. That's traumatic. That changes you. And pretending it doesn't makes it worse. So Rivera talked. About the man asking for his wife. About the 17-year-old girl. About the woman with the head wound. About the impossible math of 47 critical patients and 4 operating rooms. About the guilt that followed him everywhere, survivor's guilt, decision guilt, the weight of wondering if he could have done something different. His therapist asked him a question. If another surgeon had been there that night and made the exact same decisions you made, would you blame them? Rivera thought about it. No. They did the best they could with impossible circumstances. Then why are you holding yourself to a different standard? He didn't have an answer. The reunion he didn't expect. 2 years after the shooting, Dr. Rivera received a letter. It was from the mother of one of the patients he'd operated on that night, a 22-year-old woman named Emily who'd been shot twice in the abdomen. Dear Dr. Rivera, you probably don't remember my daughter. You operated on her for 37 minutes on October 13th, 2017. You saved her life. Emily is getting married next month. She's alive, healthy, planning a future she shouldn't have had. Because of you. I know that night was horrible. I know you saw things no one should see. But I want you to know that every day Emily is alive is because of what you did. You're invited to the wedding. I understand if you can't come. But I wanted you to know, you're her hero. You're our hero. Thank you for giving us more time with her. Rivera stared at the letter for 20 minutes. Then he looked up Emily's chart. Reviewed the surgery notes from that night. He'd barely remembered her among the 14 operations, the chaos, the blood. But there she was. Gunshot wounds to the lower abdomen. Damage to the small intestine and colon. He'd removed damaged tissue, performed a temporary colostomy, closed her up in 37 minutes. She'd survived. She was getting married. Rivera went to the wedding. He stood in the back, not wanting to intrude, just wanting to see. To know that at least one person from that night was okay. Emily saw him. Walked over, still in her wedding dress. Dr. Rivera? He nodded. Thank you, she said simply. Thank you for my life. And she hugged him. Dr. James Rivera, who had operated on 14 people in one night, who had made impossible decisions in impossible circumstances, who had carried guilt and trauma for 2 years, finally let himself believe he might have done something right. The others. Emily wasn't the only survivor. Over the next few years, Rivera heard from more of them. The 19-year-old kid with the liver injury became a paramedic. He sent Rivera a photo of himself in uniform with a note. You saved me so I could save others. The woman with the bowel perforations ran a marathon and sent Rivera a photo from the finish line. Every mile was for you. The man with the femoral artery injury became a motivational speaker, talking about resilience and second chances. He invited Rivera to one of his talks. Rivera went, sat in the audience, and cried when the man said, "I'm alive because a surgeon I never met made a split-second decision to save me." 24 survivors. 24 lives that continued because of what Dr. Rivera did in those 11 minutes of triage decisions and 6 hours of surgery. But he still thought about the 7. The question that haunts. 5 years after the shooting, Dr. Rivera gave his first interview. A medical journal wanted to document the Las Vegas response for training purposes. How hospitals handle mass casualty events. What protocols work. What lessons were learned. The interviewer asked. "Looking back, is there anything you would have done differently?" Rivera was quiet for a long time. "Every single day, I think about the 4 black tags. The patients I didn't even try to save. And I wonder, what if I'd tried? What if I'd taken that woman with the head wound to surgery? Maybe she would have died anyway. Or maybe I would have found something, done something, saved her. But you saved 24 others. I know. Rationally, I know. 24 lives versus maybe 1. The math is obvious. But medicine isn't math. Every one of those patients was a person. Had a family. Deserved a chance. So would you do it differently?" Another long silence. "No. I'd make the same calls. Because in that moment, with the information I had, they were the right calls. But that doesn't mean I don't grieve the ones I lost. The legacy. Dr. James Rivera is 51 now. He still practices trauma surgery at Sunrise Hospital. He's trained dozens of residents and fellows. He's published papers on mass casualty triage. He's consulted for hospitals nationwide on disaster preparedness. But October 13th is always hard. Every year on that date, he takes the day off. Visits the memorial. Reads the names of the 58 people who died that night, including the 4 who died at his hospital. He knows he couldn't have saved them all. He knows he made the best decisions he could. He knows 24 families have sons, daughters, mothers, fathers because of what he did. But knowledge doesn't erase grief. Last year, on the 5th anniversary of the shooting, Dr. Rivera stood at the memorial and felt a hand on his shoulder. It was Emily, the bride from 2 years ago, now with a baby in her arms. "I wanted you to meet someone," she said. "This is James. Named after the doctor who saved his mother's life." Rivera looked at the baby. At this tiny human who existed because he'd made a 30-second triage decision 5 years ago. "Thank you," Emily said again. "For everything." Dr. Rivera held baby James and felt something shift. Not the grief disappearing that would never fully go away. But maybe, finally, the beginning of peace. Epilogue, the impossible choice. What would you have done? If you were standing in that ER with 47 dying people and 4 operating rooms and 11 minutes before people started dying, what would you choose? Who gets the red tag? Who gets the black? Who lives? Who dies? These aren't theoretical questions for Dr. James Rivera. They're memories that play on repeat. Decisions that shaped 24 lives and ended 7. He carries them all. The successes and the failures. The saves and the losses. The gratitude and the guilt. Because that's what it means to be a trauma surgeon. To make impossible choices in impossible circumstances. To carry the weight of other people's lives and deaths. To do your best when your best isn't enough for everyone. Dr. Rivera still has nightmares. Still sees the ER filled with bodies. Still hears the man asking for his wife, the girl's parents screaming, the alarms going off in cascading waves of crisis. But he also sees Emily holding baby James. The paramedic in uniform. The marathon runner at the finish line. The 24 who lived. And slowly the scale is tipping. Not toward forgetting. You can't forget something like that. But toward accepting that he did what he could with what he had. And sometimes, in medicine, That's all anyone can do. The Vegas shooting memorial lists 58 names. 24 of the survivors carry surgical scars from that night. Dr. James Rivera carries all of them. The ones who lived. The ones who died. And the impossible 11 minutes when he had to decide which was which. Medicine isn't always about miracles. Sometimes it's about making the best of a nightmare. And living with the choices you made when there were no good options. Only human ones?